So once again, welcome everyone. Thank you for joining us today. Before we get started, I just have a few housekeeping items that I'd like to mention. The slides and recording from today's webinar will be made available and sent to all participants. You may enable or disable the closed captioning on your main Zoom toolbar button labeled CC. If you experience any technical difficulties, please notify me, Patrick Ahern, in the Q&A section. And questions can be submitted into the Q&A window at any time, and we will address those upon completion of the presentation. So with that said, I'll hand things over to Sari Schumann to get us started. Thank you.
Thank you so much, Patrick, and thank you everyone for joining us today for the National Alzheimer's and Dementia Resource Center webinar, Meeting Communities Where They Are, Innovative Approaches to Dementia Supports and Services. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Before we start, Chris Stockton of the Administration for Community Living will provide a brief welcome. Chris?
Thank you, Sari. As she said, I'm Chris Stockton, and I'm here to basically thank you all for taking time out of your busy days. I'm sure everybody's got 100 things going on. However, this is a very important topic, and I appreciate you all taking the time to enjoy this. Right now, we're at 360, so I can only believe that you guys believe the same as I, is that this is an important topic. Thank you, and Sari, take it from here.
Great, thank you so much. So today's presenters are Ms. Jackie Dido and Dr. Haiwan Shin. I'll give a brief introduction and then turn it over to them for the presentation. Jackie Dido has been employed by the Southern Mississippi Planning and Development District for 8 years. While at SMPDD, she has worked with the Elderly and Disabled Waiver Program, was the discharge coordinator with the Mississippi Access to Care Department, and currently is the Alzheimer's Disease Program Manager. We also have with us Dr. Haiwan Shin, who is the Executive Director of the Somang Society, where she leverages her background as a biomedical engineer to dismantle health disparities, language barriers, and low health literacy affecting older Korean and Asian American adults. Serving concurrently as the Director of the Asian American Community Outreach at UCI Mind, she acts as a critical bridge between academic research and immigrant families to ensure equitable representation in dementia studies. At this time, I will turn the presentation over to Jackie Dido to begin. Jackie?
Good afternoon, and thank you, Sari, for that introduction. I'm going to speak to you today on delivering dementia education to the African American community. Next slide, please. I'm going to start with talking about Southern Mississippi Planning and Development District. Southern Mississippi Planning and Development District, better known as SMPDD, is a private nonprofit organization that capitalizes on the years of experience and excellent partnerships with the counties we serve. SMPDD was established in 1967 to serve as a liaison between local government and the various state, regional, and federal agencies involved in economic, community, and human development. SMPDD serves the 15 southern counties in Mississippi, and if you look at the left of this slide, you can see the counties that we serve illustrated in blue. Next slide, please. Southern Mississippi Planning and Development District has many departments, which include economic workforce development and business and government finance. These departments consist of grant work, small business loans, which goes hand in hand with county and city elected officials on economic development projects. SMPDD has 175 full-time employees, and the bulk of our employees are in our Senior Services Division. The objectives of the Senior Service Division is to help seniors age in place and to remain at home and active members of their communities as long as possible. We have 3 departments in the division that provide service to meet that goal. And the first department I'm going to talk about is our Area Agency on Aging, better known as AAA. Services in this department includes information and referrals, outreach, case management, adult daycare, senior center, homemaker services, respite services, transportation, legal services, congregate meals, and home delivered meals. SMPDD's Alzheimer's program sits under the AAA department. The next division I want to talk about is our elderly and disabled Medicaid waiver. Participants in this program must be 21 years of age or older and meet the qualifications of Mississippi Medicaid. Medicaid waiver provides the following services: personal care services, adult daycare services, extended home health services, respite services, and home delivered meals. The next division I want to talk about in senior services is our Veterans Directed Care Program. It is a program that the Veterans Health Administration and the Administration for Community Living formed a partnership to develop veteran directed care that assigns qualified veterans a monthly budget to pay for their in-home care. Mississippi Access to Care, that's our MAC department, and we consider this the backbone of SMPDD because information and referrals for local supports and services go through this department, as well as screening for Medicaid waiver programs, advocacy for those seeking services. And MAC is also the call center for all referrals to the ADPI program and linking seniors with home community-based services. Next slide, please. The ADPI program was awarded to SMPDD in 2023, and it was designed to provide quality support for people living with dementia and caregiving by providing person-centered approach for people living with dementia and caregivers. The person-centered approach places the individual at the center of care or support, respecting their preferences, needs, and values while enabling them to lead decisions about their own life. We use the quality of life Alzheimer's dementia assessment for our patients with the disease, and this meets their specific needs. And with this assessment, we can meet their needs in this individual. When you meet one person with Alzheimer's, you meet one person with Alzheimer's. Our person-centered approach for caregivers, we use the T-Care assessment, and this assessment provides stress levels to reduce the stress of the caregiver. And as we all know, if we reduce the stress of the caregiver, they can provide more adequate care for their loved one with the disease. A doctor's diagnosis is not required for this program, but all persons must exhibit symptoms of Alzheimer's. We target live alongs because most of live alongs do not have friends or relatives nearby to navigate them through this process. We also focus on individuals with IDD, and we also target the people with IDD and provide legal services for them to get them through this process. Next slide, please. So why do we focus on dementia education and training in the African American community with SMPDD? First of all, in the community served by SMPDD, African Americans are disproportionately affected by income inequality and rising healthcare costs, making them more likely to experience barriers in accessing adequate health care. In addition, the communities served by SMPDD do not have adequate healthcare services in the communities, therefore requiring them to travel out of their areas to find the appropriate health care. And this is where SMPDD AAA services come into play because, as I mentioned in the previous slide, transportation is one of the services provided in AAA. And if one meets the qualifications and is involved in our Alzheimer's program and do not have transportation to their doctor's appointment, we can provide this need. And the MAC Center comes into play as well because, again, it is the backbone of SMPDD, and it can assist in helping the person obtain affordable health insurance. Next slide, please. Now, let's talk about the beginning of the partnership with SMPDD and St. Paul United Methodist Church, which is located in the African American community in Hattiesburg, Forest County, Mississippi. I received a phone call over a year ago by a member of St. Paul asking for a speaker to speak at their dementia conference. That will be the first dementia conference held in the African American community. The person who called me did not realize that SMPDD had been awarded an ADPI grant. And once I told her that we had an Alzheimer's program to assist people with Alzheimer's or the symptoms, she asked me to be a member of the planning committee. And of course, I said yes. So upon going to the first committee meeting, I noticed that a familiar face was in the room, and that was one of our ADPI partners that is employed by the Mississippi Department of Health. And when I asked her, I said, "Hey, why are you here?" And then she told me that Mississippi Department of Health award bold grants to African American churches, and they must be affiliated with Alter and provide training within the Black community. And at this meeting, that's when a wonderful partnership between SMPDD, St. Paul United Methodist Church, Mississippi Department of Health, Alter, and Bold started. The next slide, please. The committee started planning for the first conference, Dementia Conference. So we had to plan the date and time and place of the conference, the speakers of the conference, what the African American community needed to know about dementia, how to publicize the conference, outreach for the conference. Can we get extra donors for the conference? So we talked about all of this, and one of the members mentioned about Forest General Hospital, a local hospital in Hattiesburg, Mississippi, to be a sponsor. Forest General Hospital agreed, and they donated breakfast, lunch, and snacks. The members of St. Paul also put boots on the ground, printed flyers, went to door to door to homes and giving them flyers, notifying them that the conference will be held in March. WDAM, a local television station, provided free publicity for the conference, and Paulita Childs of Mississippi Department of Health and Carrie Fisher, who was a member of St. Paul Church as well as one of the Dementia Planning Committee members, interviewed and told the community about the conference that will be held on Alzheimer's and dementia. We had 178 individuals attend both conferences, and we believe the reason for this is because we put out the personal approach of the members going door to door with the flyers, the television recognition, and the participation with the local hospitals. Next slide, please. As I said, the first conference was held in March 1st, 2025. We had 121 attendees. Now, the first conference was held from 9 a.m. to 1 p.m., and the committee decided not to have a 4-day conference because most people work Monday through Friday all day, and we wanted good attendance at the first conference, so we said a half day, and we provided breakfast, lunch, and snacks. The participants included community members, caregivers, attorneys, and ministers. The committee also decided that the first conference should focus on education and resources. And we had the following topics at the first conference, which included overview of the latest developments in Alzheimer's research and breakthroughs, recognizing early signs, diagnosis methods, and the importance of early intervention, practical support, resources for families, legal rights, financial planning, healthcare decision-making for family, and of course, the SMPDD ADPI program services. The speakers of this conference was a mix of clinical professionals as well as partners of the ADPI program and our own Tanya Coyne, who's the Director of Senior Services, AAA. Mississippi Legal Services is also a partner of our ADPI program, and the Director of Mississippi Legal Services spoke at this conference on the legal rights, financial planning, and healthcare decision making for families. The next slide, please. Now, the second conference was held August 2025, and we did not have that many attendees to attend this conference, but we did have 57. And this conference focused totally on caregiving. And we had a caregiver panel discussion. We had caring for the caregiver, personal journeys. This lady told a story about her husband who had the disease, and she told her journey through that. And yours truly gave the dementia caregiving training on Alzheimer's. Now, as I mentioned before, all of us have experienced loved one with this disease. And I personally, it was my mother-in-law that was going through Alzheimer's at the time, and she passed away a year ago. As a matter of fact, a year ago today from Alzheimer's. And I also gave my personal story, ways to handle and reduce your stress, and I also talked about understanding general dementia stages, learning the benefits of engaging through activities, consider how to involve your person in daily life, and learn how to modify activity based on person's abilities. With all of us giving our personal experience, and every last one of us had different experiences and different strategies, it was really beneficial to the people attending the conference. And I would like to also add that we had two of our caregivers that are participating in SMPDD's Alzheimer's dementia program attend this conference. Next slide, please. St. Paul decided to establish Fifth Sunday, Alzheimer's Sunday. They did not think that two conferences was enough to educate the African American community on this disease. And the fifth Sunday Alzheimer's conference is held whenever there's a fifth Sunday of the month. And I had the opportunity and the pleasure of going to Fifth Sunday this past, the first Fifth Sunday this year, which was Palm Sunday on March 29th. And the speaker, Dr. Housley, spoke about the importance of brain health, eating healthy, keeping the brain active by doing puzzles and exercising. And she also spoke about early detection and going to the doctor if you believe something is terribly wrong. Also at the church, which I thought was a wonderful idea, when you walk through the door, the ushers were handing out pamphlets from the National Alzheimer's Association and gave it to everyone in attendance to that church services information on Alzheimer's. Next slide, please. So St. Paul Dementia 1 and 2 conferences, Fifth Sunday, Alzheimer's Sunday, and the picture that you see here is a picture of a home that is located directly across from the church. A member of the church donated this house to St. Paul, and it was the home of the late Mr. and Mrs. Alfonso Clark, who were lifetime members of St. Paul. And she realized the need of Alzheimer's and educating the people in the African American community. And this home has been donated as a dementia resource for people in the African American community. This gift will provide a place for the people in St. Paul to go and be educated, and it's an educational resources for Alzheimer's. Plans are on their way to renovate and include several programs that are needed in the community in reference to Alzheimer's. SMPDD will be a valuable part of the Clark House. I will provide dementia training, as well as SMPDD will be assisting Hattiesburg in becoming a dementia-friendly community. Next slide, please. So the lessons we learned today from partnerships and making things work when you come together. The first thing, knowledge is power. Being trained about dementia empowers members of the African American community to recognize and understand Alzheimer's. Education is the key to anything and everything. So it is a key to training and learning about Alzheimer's, and it makes a positive impact on the community. Remember how I mentioned the partnership for the Mississippi Department of Health, the ALTA program, SMPD, and legal services. I want you to maximize the impact of your existing partners and network to expand and reach to educate and train others about dementia. Because when you work with someone and you have the same goals with your partners and organizations, it will be a success. Last slide, please. Again, I'm Jackie Dido. I'm the Alzheimer's Dementia Program at SMPDD, and I would like to thank you for your time, attention, and care. My email is on this slide. Feel free to contact me, and I return every email, and I look forward to answering any questions that you may have in our question and answering portion of this webinar.
Go ahead, Haiwan. Thank you.
Hey. Good morning or good afternoon, everyone. I really appreciate you taking the time to join us today. My name is Hae-Won Shin, Executive Director of SMANG Society. I'm excited to share our work addressing dementia care gaps among Korean American and Asian American communities in Southern California. This project is made possible with the support from the Administration for Community Living, and we are so honored to be part of this important national conversation. Next slide. Before we dive into the details of our program, let me give you some background on who we are and the communities we serve. SMANG Society is a nonprofit based in Southern California, founded in 2007. Our mission is to promote the health and well-being of older Korean American adults and their families through education, services, and resources that help people age well, live fully, and prepare for the end of life with dignity. Just last year alone, we reached almost 200,000 people through in-person programs, virtual sessions, YouTube, and our publications. This ACL grant is especially meaningful because it is the first federal grant SMANG Society has received. But this is not new to us because we have partnered on previous ACL grant with Alzheimer's Orange County, building strong community trust and honing our expertise in dementia care. Next slide. Our primary population is Korean American older adults and their families. Many are first-generation immigrant with limited English proficiency. We also serve second-generation or sandwich generation adult children caregivers, as well as other Asian American and multi-ethnic older adults and their families. Our work is based in Southern California, Orange County, Los Angeles, and San Diego. But we reach nationwide and nationwide the Korean American families as well too. We also rely on strong partnerships with nonprofits, churches, and academic institutions, and this partnership brings together community trust and research-backed expertise, which really maximize our impact. Next slide. Here's what we hope you will take away from this webinar. We hope you will understand the unique cultural, linguistic, and generational barriers within Korean American families and how to effectively support them. You will also be able to evaluate key challenges and identify successful community engagement strategies for delivering culturally tailored dementia care to Korean and other Asian American families. Next slide, please. Okay, to understand our work, it helps to first understand the challenges many Korean American families face when it comes to dementia care. 82% of older Korean Americans wants to be cared for by family. 85% of older Korean Americans report that language barriers and lack of information make it hard to access support. It gets more complicated when you consider language and generational gaps within families. Many first-generation parents speak mainly Korean and hesitate to share challenges, sometimes out of pride or to avoid burdening their children. Meanwhile, their adult children, the sandwich generation, speak mainly English and want to help, but often are not aware of the Korean language resources their parents need. That gap makes communication and coordinating care really tricky. Next slide, please. So, what we are doing, how do we address these gaps? With the support from ACL, we launched the Sumang Memory Care Program. It's a multi-level initiative designed to support both older Korean Americans and their family caregivers, including second-generation adult children. This program has 4 key components. 1, programs for Korean Americans living with dementia and their family caregivers. 2, programs for families caring for individuals with intellectual and developmental disabilities. 3, dementia gatekeeper training to recognize and respond to early signs. 4, professional training for healthcare providers and faith-based ministry leaders. I will walk you through each in more detail. Next slide, please. Let's start by looking at the programs that directly support older adults living with dementia and their family caregivers. We provide services for both parents and their adult children, offering support in both Korean and English to keep both generations as informed as possible. We start from community education. Community education serves as a gateway to increasing awareness about dementia, including its warning signs, brain health, and the importance of advanced care planning. Early memory loss, in short, EML, is for older adults noticing memory concerns but not yet diagnosed. It provides dementia education, practical strategies, and resources to help maintain independence as much as possible and plan for the future. We also provide memory screenings using MOCA, and with participant consent, we share results with their primary care providers and families. For those already living with dementia, whether live alone or with family, we provide care navigation, which is ongoing individualized support based on UC San Francisco's care ecosystem model. For each person, we start with a thorough assessment and care planning, looking at things like home safety, managing symptoms, caregiver wellness, and planning for long-term care. We also connect families to the right resources and community services, making sure they have the support they need. Follow-ups happen regularly, anywhere from weekly to monthly, depending on each person's need. We also provide caregiver support to groups in Korean and English. It is available in Zoom, in person, on Zoom, as well as Facebook Q&A group. This flexibility helps reduce barriers and allow us to meet caregivers where they are. And we are excited to be launching Adult Day social programs. Our Orange County location is in the pre-licensing stage, with Los Angeles soon to follow. These programs provide structured engagement and socialization for individuals living with dementia, while also giving caregivers much needed time to rest and recharge. Next slide, please. We also identified a critical need among families supporting loved ones with intellectual and developmental disabilities. As these individuals age, their risk for Alzheimer's disease and other dementias increases. And in some group, the risk is significantly higher than in the general population. To address this, we develop a caregiver education program. Our education helps families understand how dementia may present differently in individuals with intellectual and developmental disabilities and provide practical strategies to support existing abilities, maintain engagement, and improve quality of life. This program is offered in English, Korean, and Vietnamese in collaboration with trusted community partners. Next slide, please. To ensure timely support, we rely on trusted community members to help recognize individuals with dementia in its early stages. That's where our gatekeeper training comes in. Dementia gatekeepers are community members trained to recognize early signs of dementia and connect individuals to the right support. We focus on individuals in high contact roles, senior housing managers, receptionists, retired pastors, so they can act as ears and eyes of the community while building referral pathways to our memory care program. Next slide, please. Alongside community gatekeepers, we also provide professional training for healthcare providers, mainly nurses, in collaboration with Korean American Nurses Association, Southern California, as well as faith leaders. So everyone in the care ecosystem is connected and informed. These training sessions focus on supporting individuals living with dementia who live alone and helping care partners manage challenging behavioral symptoms, again, while also building referral pathways into our memory care program. Next slide, please. We were awarded this grant in July 2023, and the program officially kicked off in September 2024. Since then, we've made significant progress across all areas of the program. We reached over 1,200 people through 27 community education sessions. We conducted 30 memory screenings. Our early memory loss program reached 131 participants. Our care navigation enrolled 23 individuals living alone and 38 caregiver participants diet, providing personalized support. We also trained 14 dementia caregiver support group facilitators, launched 4 caregiver support groups, including an English Zoom group specifically for second-generation adult children, and created a Facebook-based Q&A support group to connect families. Our IDD family caregiver program served 31 participants and 76 gatekeepers, along with 138 professionals received training. Next slide, please. It is still early, but we can see our program is already making a difference, showing impact. Gatekeepers who completed our training demonstrated increased knowledge and improved attitude towards dementia. They also reported reduced frustration and greater confidence in interacting with individuals living with dementia. Next slide, please. Similarly, our early memory loss workshop participants also showed a notable increase in awareness about the importance of home safety measures and advanced care planning. We are especially encouraged that 7 participants completed memory screenings and 4 have gone on to engage with our care navigation services. That shows that increased awareness is translating into meaningful action. Next slide, please. And the same goes for our professional training. Our professional training helps nurses build the skills and confidence in caring for older adults with dementia. Nurse participants gain knowledge, feel more comfortable interacting with people with Alzheimer's and other dementias, and they also mentioned that they better understand caregivers' need. This supports early identification, timely referrals, and stronger community-based dementia care networks. Next slide, please. I like to share the story of Mr. K. He lives alone in Los Angeles and was worried very much about his memory. When he saw our memory loss workshop in the Korean newspaper, he decided to attend. But to get to the session, Mr. K left his home at 5 a.m. and transferred between 4 different buses each way. And he attended all 3 sessions in 3 different days. He completed the program, and further, he took meaningful steps like creating an emergency plan and an advanced care planning. Mr. K's story shows how education doesn't just raise awareness, it can lead to real tangible action. Next slide, please. Okay. Let me share another story. Our participants is a lady, 75-year-old widow living alone who was struggling with memory, language, and could no longer drive, leaving her isolated. Our team worked with her on getting around and planning for the future, teaching her to use Uber and guiding her through advanced care planning. She regained independence, practiced skills that support her brain health, and completed her advanced directives. Her story again shows how the right support can turn worry into action and restore confidence. Next slide, please. For the past couple of years, we learned so much along the way. Community education and ethnic media work for our outreach. Partnerships with churches, senior housing, and senior centers bring meaningful engagement. And we have seen that combining grassroots gatekeeper training and professional training build trusted referral networks. Next slide, please. But we faced challenges, and actually many challenges. First, hiring fully bilingual staff fluent in Korean and English and trained in dementia care is extremely difficult. To address this, we've extended recruitment through community networks, professional associations, and academic partnerships. Data collection is another hurdle. Surveys are a completely new concept for many older Korean Americans, and concerns about privacy can limit our evaluation and services. We tackle this with radical transparency, clearly explaining that we only collect minimal identifiers like first, last initials and partial phone numbers. And we encourage and we ensure that all information is confidential and used solely for program evaluation. Reaching older Korean Americans referred through our gatekeepers or professionals for care navigation is another very challenging problem, because many older Korean Americans won't answer unfamiliar phone numbers, even though gatekeepers and our professionals provide our contact numbers and inform them we will contact them. So we change our strategy. Rather than waiting and reaching out through phone, we actually go where they are. Senior apartment complexes, community centers, and churches, we go there and we provide education, memory screenings, and even on-site intakes. This experience reinforced an important lesson. Cultural understanding and consistent presence are essential. By adapting our approach and meeting people where they are, we were able to connect individuals to the care and support they truly need. Next slide, please. I also like to share that we're really honored that our work will be shared at several national and international conferences in 2026. And it's exciting to see cultural dementia care getting the recognition. Next slide, please. None of this would be possible without the support of our funders, partners, and our amazing Sumang Society team. A huge thank you to ACL for funding support and to our partners, Alzheimer's Orange County, UCI Institute for Memory Impairment and Neurological Disorders, in short, UCI MIND, Korean American Nurses Association, Southern California, and our evaluator, Dr. Kathy Lee at UT Arlington. And of course, to the Sumang Society team, whose dedication drives this program every day. Next slide, please. Thank you so much. You can see the contact information here. Please feel free to reach out to us. Thank you so much.
Thank you so much to both of our speakers for your great presentations. We'll move to our question and answer session now. Feel free to put some questions into the area that's marked Q&A in your webinar platform. We'll start with a question that came through while you were speaking. You both used the term and highlighted the importance of meeting the community where they are, which also is part of the title of our webinar today. Can you talk about 1 to 2 strategies for doing that in the communities you serve? Jackie, do you want to start?
Well, one of the strategies is like I told you with partnering with someone who has the same goal that you do. And I believe that's what made us so successful in the African American community in Hattiesburg is because St. Paul as well as SMPDD, we had the goal of educating people with Alzheimer's. The St. Paul was focused on the African American community. We are focused on just educating everyone, but with that goal to educate everybody and you have that partner, you get a strategy. You get that strategy. You come together, get what you want to see, and then make plans from there.
Great, thank you. Taiwan, would you like to answer for your community?
Yes, and that's the very important strategy because we also recognize the go to the places where the communities are actually there. That's very important. So we work with community partners, senior housing complexes, churches, and senior centers, and we provide education there, and we explain about our programs, and we even conduct memory screenings and intake at the spot, and that's the way we raise awareness at the same time, bringing community members into our programs.
Great, thank you. Okay, let's see. Haiwan, can you talk a little bit about how you recruit and retain the dementia gatekeepers and if they're compensated in any way?
No, they are not compensated at all, but the community members, they saw the need. For example, our gatekeepers from various locations, like one, I can say like federally qualified community clinic, the receptionist, they saw many patients are actually showing dementia symptoms, early symptoms, but their clinic cannot take care of that families, and they don't have any support for the family caregivers. So that receptionist at the federally qualified clinic outreach to us and mentioning like they want to get the trained as a gatekeeper and try to refer those families to us. So we train them. In the other gatekeepers, we trained the senior housing manager. There's one big apartment in Los Angeles, 110 house units, and almost 800 units are Korean American older adults. Many of them are living alone. So the manager saw many Koreans wandering around after the sunset, keep forgetting things and keep repeating the things. So she clearly sees something going on. So she approached us and asking us, are there any ways we can collaborate? So we train her as a gatekeeper. And whenever she saw those people either live alone or with a family, they report that person to us. So we provide the dementia memory care programs for them. And another example is the Kaiser Permanente. Kaiser saw Korean patient in the patient actually families asking, are there any Korean services? So we train Kaiser Permanente social workers and receptionists. So whenever they see and they get requests from their patient, they refer the participants to us. But again, the challenges are when they refer the participants to us, when we reach out to them and when we call back the participants, many of them won't answer the phone calls because the phone number is new to them, even though the gatekeepers keep mentioning, you will receive a phone call from this number. This is the Humane Society number. All the others forget that and they won't answer. So we go to the community site.
Great. Thank you so much. Jackie, can you talk a little bit about how Alzheimer's Sundays are coordinated? Is there someone at the church that coordinates, or is there a community partner that assists with this?
Alzheimer's Sunday is coordinated by St. Paul. They decide on who speak, what they're going to speak about, and it's a part of them. And they invited me and pulled us in. When I say me, SMPDD, to just be a part of it. But the whole planning is all St. Paul.
Great, thank you.
Mm.
Can you both talk a little bit more about marketing your program? So what's been the best way, Haiwan, you can speak to the best way to market to your communities that you're serving. You've mentioned some troubles with trust and answering phones. What kinds of marketing have you seen that has actually worked? And then we'll go to you, Jackie, with a little bit different twist.
Okay, so we thought the ethnic media and Kakao works very well. So ethnic media, we utilize Korean major newspapers. We have several newspapers, but major ones are Korea Times and Korea Daily. We used that Korean newspapers as well as Korean radio. Humane Society runs AM 6050 radio, so that's every Sunday, 30-minute session. We emphasize our programs through that radio channels. And we also use Kakao. Kakao is much like a Korean version of WhatsApp. It shares the information. We have Kakao group of Korean Americans, about 4,000 members in the Kakao chat group. So every Monday, we send out useful information to those 4,000 members through Kakao, and we share those informations to them as well. And we keep building that Kakao membership as well.
Great, thank you. Jackie, can you talk a little bit about the best way that you've had to reach populations you serve, including those with intellectual and developmental disabilities?
Yes, we do tremendous outreach. We started with organizations and with memory care facilities, with the police department, with our senior care facilities. In our 15 counties, we have 13 senior care, and we've gone in and we would do dementia training. We would give them flyers on our program. We would do outreach. We would go to health fairs in all the 15 counties that we serve. If people call us and say, we heard about your program, we go there and we speak. But we started out with just getting together and strategically wondering where can we start. And we started with the senior care facilities in our 15 counties first. And then we just branched out to the communities, to the churches, to, like I said, the police station, to organizations. And that's how we tell about our program and what we are doing. And the word has spread like wildfire. We get calls about coming to do training all the time. And we have two case managers as well as myself. And at this time, we're spread pretty thin because we are always doing outreach or training at least twice a week, minimum twice a week.
And in our case, we work with community partners serving particularly for IDD population. So there's the nonprofit organization called Being Built Together. They have almost 400 members throughout the United States, mainly living in Southern California. Those 400 families are families caring for their loved ones with intellectual and developmental disabilities. Another nonprofit called CISO Community, they also serve IDD families, but they are more likely training people with individual and developmental disability with a job training, like a coffee shop barista, and we work with them as well. And there's another organization, Korean American Special Education Center. They also serve people, especially the younger children and young adults with IDD. So we work with those Korean American the IDD family serving organizations, as well as several Vietnamese American IDD serving nonprofits like BPSOS. So in our case, we are particularly work with those designated nonprofits.
Great, thank you. We do have a question about referrals to your services. Someone has been asking about which are the greatest referral resources to the programs that you've been talking about. So Jackie, for all of the programs that you mentioned, what have been the best referral sources and how have you found them and gotten them to continue to funnel people to your services?
We have the main, and I'm looking like this because the MAC Center, that's where all referrals come through. And when we were awarded this grant, we sat down and said, how can we get the referrals? What is the main place to get these referrals? And we came up with the MAC Center. So all of our referrals, I think as of today, we have had 197 enrolled and we have like 133 active. And every last one of those referrals have come through the MAC Center because in our area, in the 15 counties we serve, people know about SMPDD. They know that we strive to help seniors 60 years and older. And they come there, some of them come here looking for one services and they found out that we have an ADPI program and we get that referral and they just pass the word. It started off with our strategy letting the MAC Center be our referral source. And really, that's all we've done. Everything has come through the MAC Center.
Great, thank you. Yvonne, can you talk a little bit about the referral sources that you've had the most success with?
Yeah, so I think our referrals came everywhere from the ethnic media, our KakaoTalk outreach, community education, gatekeepers, and professionals. It comes everywhere, but I can say like the deploying our staff to the actual site, we received more care ecosystem, care navigation enrollment.
Great, thank you. We have one question about the adult day licensing and the different components of the program. Can you talk a little bit about that?
Yes. So getting the adult day licensing requires a state license. So we work with California Department of Social Services, and they do have application packet. We have to kind of fill out all the forms, and we also need to go through fire department inspections because they have very specific requirement we need to meet and follow. So it took us more than 6 months to prepare documentations as well as get inspected.
Great, thank you. We have one, I think we can probably fit this one last question in for both of you. And it's an important one. So someone's asking about, balancing the amount of services that you provide and possible burnout from staff. How do you address those kinds of issues of ensuring that you can keep your staff while also delivering services at a high level? Are there any strategies you've used or secret sauce that you found?
Um, I'm going to go first with that, and I think the secret is to balance. Is if they need a day or two away, don't question, give them that time off. Let them recharge and come back. And I really believe that's the key. Don't put any more stress on them than what they have, because they have a very stressful job. And some of them just need that mental health day. And when they need that mental health day, we don't ask any questions. We'll just see you when you get back. And they'll come back recharged and we start over.
Great, thank you.
So what is the mental health day, Jackie? Because
It's really mental health day. You know, you need to be, when that's, I'm doing quotes because that's not what it's called. I mean, that's the slang, but mental health day. And then
So
they just tell you, I need a break. I need a day off. So go take care of yourself. Go get a pedicure. Go just like you do your clients, the people with the dementia, the caregivers. Go take care of yourself. Go get a massage. Come back, and then we'll start over, because it's going to be here, and it's not going to get any better, because that's what we do, and that's the clientele we're dealing with. So to do better for your client, you have to take care of yourself. And for us, we keep employees that way.
mhm,
I think that's a great strategy, and I will adapt your mental health day for our staff as well too, because
Mhm.
that's the thing make me wake up during the night, because we all stressed out, and dealing with people with dementia and their family caregivers is not an easy job. So we
right.
also try to give our staff as much as time off they needed. But I think that mental health break, mental health day or mental health hours, that's a great suggestion. I will adapt it.
Yes, it works.
Great, thank you. A little self-care can go a long way. So
Mhm.
thank you both so much for your wonderful presentations and providing us with so much information that's useful for where we work and what we do and our outside lives as well. And thank you to all the participants who have come today. We're so glad you joined us. We'll have another webinar on April 29th at 2 p.m. Eastern. That webinar is called Can Do, Reframing Dementia Support and Education to Focus on Strengths and Resilience. It'll be a great session, and we will be sending a reminder about that in the next few days, and an invitation also to join us at our May webinar. So thank you, everyone. If you have questions, you can contact our team at NADRC-webinars@rti.org, and we'll be happy to answer your questions. For now, we'll say have a great afternoon, and thank you once again to our speakers and everyone who came to participate today. Take care and have
Thank
a
you
great
for
afternoon.
having me.
Of course.